everyone. Thank you so much for coming out tonight. And before I get into the presentation, I want to start off with a story that is actually a really good example about what I'm going to be talking about tonight. Now, 2 weeks ago, I went to Haiti with a group of people and we worked in a medical clinic. And one of the women that I went with was absolutely amazing. She decided to clean and organize the entire medical clinic. And she didn't get overwhelmed, and she seemed to never even get tired. And every single box, everything was just organized. And I've never seen anybody with that kind of endurance and patience. But later in the week, we talked to her, and she started really opening up to us. And she said, you know, guys, I think I might have a problem. She's like, when I'm at home, I clean all the time. That's what I do. I clean houses, I organize for people. But when I'm not doing that, I'm also doing that at my house. And I work 6 to 7 days a week, sometimes 10 hours a day. And she's like, I think I'm a workaholic. And so I started asking her, I'm like, well, is there stuff you're dealing with? I mean, do you think you might need to talk to somebody, stuff you're running from, things that you don't want to think about? Are you trying to distract yourself? And she admitted that that was all true and that she needed help. So in the next couple minutes, I'm going to be talking about a policy that I think doctors should make. I think that doctors, if they put people, now these are primary care doctors, which they put people on antidepressants and anti-anxiety medication, but they don't follow through and see if they're seeing a therapist, and they don't see if the real underlying problem is being taken care of. So that's what we're going to be talking about tonight. And the thing is that people, they don't talk about this or think about this too much. So I hope for you can have an open mind and you can just come up with your own conclusion on how you feel about this subject. So I'm not going to tell you just my opinion or stories that I've heard. I've done some research and I've found some interesting facts that I found from sources. So a quick overview of what we're going to be talking about is, first I'm going to introduce the problem, and then we're going to talk about how this problem actually keeps people from getting better, and then we're going to see about a solution. So let's say that you break an arm or a leg or a bone or any bone, and you need to go to the hospital and get it fixed. But the doctor doesn't give you a cast, or he doesn't even set it back in place. He doesn't send you to physical therapy. All he does is give you pain medication. Now, you can imagine what that's going to end up in the next couple weeks or months and all the problems that are going to come from that. And if you think about it, that's the same problem with this. If somebody has a problem like a panic disorder or a strong depression and they're taking medication for it, that's good. The medication is really going to help them, but they also need to be in therapy at the same time. And a therapist should be the one who tells the doctor or stays in communication with the doctor, and the therapist should say when it's being refilled and when they should come off of it and how they're being weaned off of it. So how does this problem keep people from getting better? Okay, and I have a slide right here. If somebody takes meds without therapy, it can make it really difficult for them to heal. And an example of that is people can get dependent on the pills. According to drug recovery site, if Xanax is used for more than 8 weeks, it can be really harmful to somebody. They can start depending on it, and they can start having a tolerance for it. And Xanax is known to be, it can really help people, but it can also be harmful if people become dependent on it. Another thing to think about is, if somebody's taking medication and they're not in therapy, how are they going to really face the problem? Because the whole intention of these pills are to keep people from feeling something, but let's say again, example, someone has a panic disorder, the number one thing that therapists say how people can really recover on a long term is if they are reintroduced to what frightens them and they're reintroduced to what makes them panic. So in order for them to do that, they need to feel the fear. And these medications make it so you don't feel really anything. So, like I said, the drugs aren't the problem. The problem is if the person is not in therapy at the same time. So here's another question. What happens if somebody has depression And it's a chemical thing, it's a seasonal thing. It's not something that's incredibly complicated. So if they were with a therapist, they wouldn't really have much to dig up from their past, or there's not a lifestyle problem and it's just strictly chemical. It's still important to talk to somebody about it because the feelings are real. And that can lead to so many other problems if they're not being talked about. And another site here, according to helpguide.org, it says that a U.S. government study states that less than half of people on antidepressants, literally less than half of people that are on antidepressants, they actually become symptom-free. So they're not always working all the time, and no matter what reason that somebody's depressed, it's really important that they're also in therapy, because they could, if they're not, they could miss out on a lifestyle that could be a lot more beneficial to them, and a therapist can guide them in things that they can change within themselves to make things easier for them, which would be a lifestyle change. So a solution for this is, to restate what I said before, the person should be in therapy if they're taking antidepressant or anti-anxiety medication, and the therapist should be the one who decides when a prescription is refilled and when they're weaned off, because they're going to be the one that really understands how the person's doing and what they need. And right here I have a picture of an artist. His name is Tyler Jordan, and here's a bottle of pills, and you see smiley faces and sad faces, and he's just basically saying this is what it looks like when someone's over-medicated. There's just a whole bunch of different emotions flying everywhere and whatnot. So a quick overview of what we talked about. First, I talked about the problem. We all know what the problem is. And then we talked about how this problem can keep people from really getting better from the real problems going on inside. And then we talked about the solution. So I hope that from talking about this, I know this is something that people don't really think about too much, but I hope that some things will come into light for you, and maybe later on it'll come up in a conversation and you can come up with your own conclusion on how you feel about it from hearing some things. So does anyone have any questions?
Well, what do you think about someone who has like an opposition to pharmaceuticals, like they have like more of a natural, like holistic kind of alternative? Do you think that should be coupled with therapy as well?
Oh, of course. I mean, I think that these pills are for people that they're desperate and they don't really have any other outlet, and they feel like that is the way that they can feel normal. But if they can go other routes that are less dangerous, I think anyone would say go for the natural first, and if that doesn't work for you, then go for the other pills.
Okay.
So I'm all for natural. And I actually have ginger Altoids if anyone wants some, which is a natural anti-anxiety. I'm going to pass them around.
I have another
Anyone else?
question.
Okay, what's up?
As far as like regarding insurance providers, what if the insurance covers only like the prescription, or if it only covers the therapy, not the prescription? What would
I think it would be more difficult for them to get the pills. I mean, I've heard from a couple people, they've told me that if they are on health insurance, it can be really cheap to refill their prescriptions, and if not, obviously it's not. So I think the problem for people really getting dependent is when they are on health insurance and it covers it, because they can get whatever, as much as what they want from their doctors without a referral or anything.
Okay.
Anyone else? Yeah?
You mentioned Xanax. I went to a doctor, not related to any type of depression or anything, but he was talking about Xanax, and he says that he prescribes Xanax so much that they should put it in the public water supply. Do you find that that's true, that Xanax is prescribed to everybody so much?
Yeah, I do. From what I've heard, I mean, I only know 2 people that are on it, and neither of them are abusing it, but I think that it can be a problem, because it is an easy fix, and for somebody that really needs to be on it and they're having panic attacks and they feel like their life's falling apart and they can't function without literally panicking about everything, then that's really important. And I'm not dissing Xanax or anything, but I do see another side of it, and I think that sometimes people abuse it because they can't get as much as they want if they have health insurance, depending on their health insurance company. But yeah, a lot of things are abused. They can get it from their primary care doctor. So, anyone else? All right, thank you guys.